If you're in a car that's sinking, most people would try to open the door to escape. But this is nearly impossible because of the pressure of the water. Instead, you should focus on the windows. If they're electric, try to lower them quickly before the system fails. If the windows don't open, use a sharp object to break the glass, targeting the center. And if all else fails, wait until the car is fully submerged. By this time, the pressure should have equalized, allowing the door to open more easily. The army ant is placed on the wound and positioned so its jaws clamp tightly on the edges, securing them together. Then the ant's body is twisted off, leaving its head and mandibles in place, which acts as a stitch. More are added depending on the size of the wound, and these ant stitches are left in the skin until the edges of the wound stay closed on their own. Inside, the stomach is cut and stapled, and a small pouch is created. This new pouch is only about the size of an egg. Then, the small pouch is connected directly to your small intestine and becomes your new, drastically smaller stomach. This new stomach can only hold about 1 ounce of food, which helps you cut down on eating and drop weight. A beanbag round is just like a normal shotgun shell, except instead of pellets, it's packed with a small beanbag. These small fabric pillows are filled with tiny balls of lead, and they're designed to incapacitate rather than penetrate. They're used when law enforcement needs a non-lethal option, although impact can be significant, almost like getting struck by a fastball. When you use an inhaler, a cloud of medicine passes through the mouth and into the trachea. As this fine mist travels deeper, it reaches the tight, constricted muscles around the airways. The medication sends signals to the muscles to relax, causing the airways to widen. And as they open up, it allows the air to freely flow, which helps you breathe. A dislocated jaw pops out of its normal position at the joint, which sort of disconnects it from the skull. In this position, the jaw hangs awkwardly, making it incredibly painful to move. Now, if it's not too bad, you can bite down on gauze to stabilize the jaw, then carefully push the chin back into place. But in severe cases, you'll need a doctor to essentially rehinge your jaw by forcefully shoving it back into place. This is an ear candle, and most people believe that putting it into your ear and lighting it creates a vacuum that sucks out your earwax. But that's not actually true. It's been proven that these candles don't actually produce a vacuum, and instead of pulling the earwax out, the melted wax from the candle can actually drip down into your ear canal, and this wax can harden, causing blockages inside the ear that might require a doctor to remove. If you shoot a gun into a body of water, some people think it will completely stop the bullet. But is that actually true? Well, water is much more dense than air, and this can make the bullet rapidly lose speed and energy, usually stopping within just a few feet. But if you threw in a grenade, this change in density has less of an effect, and it will still cause a powerful underwater explosion, creating dangerous shockwaves. An IV goes directly into your vein to administer medicine into your bloodstream. But if it's not placed correctly, the IV can sometimes become dislodged and fall out of your vein. Now, it'll still continue to pump medicine as it leaks into the surrounding tissues. This makes the tissues painfully swell as the medicine floods into the body, causing bruising around the area. If your parachute fails to deploy while you're skydiving, first check for any tangles or obstructions in the lines. If that doesn't work, pull the reserve parachute handle immediately. If the reserve chute also fails, try to spread your body to increase air resistance and aim for a safe landing spot like a soft field. Brace for impact by slightly bending your knees and preparing to roll to absorb